I'm Meir Stampfer, professor of epidemiology and nutrition at the Chan School and also professor of medicine at Harvard Medical School. Well, I initially trained as a physician, and my goal in medical school was to try to do preventive medicine. So I was looking for a specialty that would enable me to do that. But they're hard to find. Luckily, in my very last year of medical school, I stumbled upon epidemiology and knew that that was the track for me. So my research career has been pretty long and varied. I started off in cardiovascular epidemiology, but then being closely connected to the Nurses' Health Study and helping to found the Health Professionals Follow-Up Study and Nurses' Health Study 2 and the Physicians' Health Study. Those all were cancer-related cohorts. So my efforts turned more and more towards studying cancer. I've been involved in cancer research in a variety of cancer sites, including breast cancer, colorectal cancer, and most recently, my main work in cancer has been in prostate cancer and in brain cancer. I was really drawn to the School of Public Health to learn epidemiologic methods in detail. Even back then, the department was very strong in methods, and over the years, it's become stronger and stronger. My goal has always been to expand the range of practical methods and approaches that we can take for prevention. Very little prevention work had been done in cancer epidemiology, so that was the big draw for me as a means to expand that field. There are many ways in which the cancer epidemiology program at School of Public Health stands out. One is the amazing resources that are available for cancer research. These include the cohorts that I described earlier. There's no comparable population resource anywhere in the world with repeated dietary assessments, repeated assessments of physical activity and medication use, and a whole host of other exposures with very high rates of follow-up. So that is quite unique. We're part of the Dana-Farber Harvard Cancer Center. So we have close by experts in the diagnosis and treatment of cancer of every sort, and the world's authorities are just right around the corner from us, and they're ready and willing and happy to help. Nothing comes close to the opportunities, really. Sounds like bragging, and I suppose it is, but it's true. I think when I first came to Harvard, I felt a little intimidated that how would people receive me, and how would I fit in as a new student. And I found the atmosphere back then, and it's really remained and even grown of welcoming and helping, nurturing, despite all these brilliant minds, or maybe because of the brilliant minds, there really is a sense of community and commonality of values to improve public health. So that really makes it a special place.